Good morning, I'm Dr. Tim Jochen for Best of Both Worlds, and we have Ms. Enadina here today to do a demonstration on leg veins. Now, when people complain about their leg veins, there's three types of veins that we're looking at. The biggest ones are called the varicose veins, and those are the ropey ones that pop out of your skin. Next, we have the ones that are like a greenish bluish discoloration that are deeper in the tissue, but they don't pop out. These are some examples. Let's see if she's got any. Yeah, see these bluish green ones deeper? These are the reticular veins. And then the smaller ones are the ones we're treating today, which are these tiny little spider veins, like these itty bitty little ones. Now, when we talk about treatment of veins, we work from the bigger to the smaller. So if you have varicose veins, you need to have a treatment done for those, which is called an ablation. We can either ablate those vessels with a radiofrequency, which is just heat, or we can use a laser, which again produces heat to get rid of those veins. Then we work to the middle-sized ones, which are the reticular veins, and then we move down to the smaller veins. Now, the reason we do this is the bigger veins can be a sign of incompetence of our valves. That means that the valves aren't working, so the blood is just going and rushing into these veins, and so they get engorged. So we have to take care of that valve problem before we can move on to the smaller veins, because if we do the smaller ones first, there's that pressure that's going to make them reappear right away. So you're wasting your time and money on a leg vein treatment. So in a younger person like Enadina, we didn't do an ultrasound to see if there was a deeper problem because she's so young. And she doesn't have the big veins or the biggest ones, the varicose or the reticulars. So what we do when we do this treatment is, first thing we do is we're going to wipe down the area. Then we select which agent we're going to use to treat the veins. Now, historically, we've had sodium STS, we have glycerin, and then we also have normal saline. And so with these, we choose for the smallest veins glycerin. I like this one because it has a low risk of causing an ulceration, a low risk of causing what we call matting, where you inject one and you get a bunch of tinier ones in the surrounding area, and also low risk of staining, which means that the blood can drip out into the area and cause a brown discoloration. So I think this is the one we're going to choose for her tiny little vessels. In our practice, we also use ethoxysclerol. It's called Asclera, and I really like this one, again, because it's supposed to be less painful than some of the other ones, and it has less risk of matting and the discoloration. But today we're sticking with the glycerin. It's a little bit thicker, but it works really great. If you're going to be doing your vessels, your little spider veins, keep in mind it does take more than one treatment. So my patients that come in and say they want one treatment are usually disappointed. In our practice, we sell them in packages of 5 to 6 because we want to make sure you get a result so you're not unhappy. Now, it's a really easy technique where we're just going to cannulate the blood vessel, which means we're going to put the needle in the blood vessel. Now, Enadina, could I have you roll over for me, please, just so we can get a better view? Thank you so much. Okay, so these are the ones that were the worst, right? So yeah. Can you get on over here, please, Garrett? Okay. And here we go. Made them nice and clean. Now, I like the glycerin, too, because it's just a really natural product to use. So it took me years to perfect this, but it's really simple. We just get the cannula or the needle into the vein and see, we inject it and see how that vein just disappears, and it's disappearing all the way up. So now we're going to go over to this vein and do the same thing. See how it makes all those blood vessels disappear? Now what we're doing is we're traumatizing the blood vessel wall, so they aren't going to disappear right away. They actually get irritated and then they die. So it takes about 4 weeks before we'll see a result. But do you see how nicely those are disappearing? We're going to do this one here. And once you get in the vessel, it just clears them all up. Let's see here, we have a couple here. See, if you get the vessel, you can get all of them in the surrounding area to go away as well. We're just going to do one more here. and we'll repeat this cycle every 4 weeks. Now, there's really not a lot of aftercare. Some people will have you wrap your legs. I typically wrap the legs for 24 hours and then tell people if they can wear their compression stockings for 2 weeks. The side effects are really minimal, just a little bit of bruising. On a very rare occasion, you'll get an ulceration. I don't really see that because I've been doing it for so long now. I very rarely see that at this point. But that's really all there is to it. How was the treatment, Anadina?
Painless.
Painless? Mm-hmm. Great. Okay, thank you for tuning in.